Hey, so my name is Marshall Cates. I'm a pharmacist here and I serve as the RPD for the PGY2 in psychiatric pharmacy, as well as a preceptor for the PGY1 in general pharmacy practice. And I'm excited to get to interview you today. So we're really excited to have you here at the hospital with us today. Why don't you go ahead and tell us a little bit about yourself?
My name is Catherine Moore. I go to Samford McWhorter School of Pharmacy. And what else do you know? Sorry, this is my mom. Hey mom, can I call you back? I'm in an interview. Okay, I don't know how it's going. It just started. Okay, I'll call you back. Alright. Bye.
I think one of my greatest strengths is honestly how much people enjoy and appreciate me. Let me give you a couple of examples. So in high school, I was prom queen and I was valedictorian. Honestly, I really kind of ran the entire high school, and it really wasn't much different when I came to college. My freshman year, I was elected to SGA, and then also I was on homecoming court, obviously. Sophomore year was a little bit more of the same. I ended up getting an elected position within my sorority, officer in a couple of different organizations, and then I ended up starting pharmacy school. So first year of pharmacy school, I got off to a little bit of a slow start because I really wasn't sure what to run for. But then once I decided what to run for, I ran for it all, and I got it all also. So president of a couple of different organizations, I feel like when the administrators think about like who is the model student at the school, I really think my face is what comes to mind, to be completely honest. And I think that shows through my interactions with patients also, because I really feel like all patients that I meet, and physicians, nurses, and other pharmacists, like they love me. They really sincerely love me.
My name is Elena Stroud. I grew up in Montgomery, Alabama. I completed my undergraduate coursework at Samford University, where I then went on to complete my PharmD at Samford's McWhorter School of Pharmacy. After my first year of pharmacy school, I decided to pursue my MBA at Samford's Brock School of Business. So as you can tell, I really enjoy learning. Outside of that, I enjoy traveling and being outdoors when I can, and I'm just really excited about this opportunity to get to learn more about your program today.
What is your biggest strength and what is your biggest weakness, and how do you think you can work on those?
I make pretty decent grades, so I guess that would be a strength. And then a weakness, I have a pretty bad memory, so sometimes I forget to set an alarm to wake up for class, so I'm either late or I just don't make it.
I have a lot of strengths. I'll just list a couple. I am intelligent. I am approachable. I am friendly. I generally get along well with others. As far as weaknesses, honestly, I think my biggest weakness is sometimes people tend to be intimidated by me because of how put together I come across and how successful I am, which can be really frustrating. But that's something that I'm working on.
Well, I'm very adaptable to different situations and different people. Sometimes it can be hard for me to not be in control of a certain situation. However, through my APP rotations, I've really learned a lot about how to work in a team environment, and I'm very hopeful that pursuing a residency will give me even more experience in that area.
So why exactly are you interested in doing a pharmacy practice residency?
Well, my advisor told me that I had to.
So I really think that I would be such a good fit here, and y'all would be so lucky to have me.
Well, I know that an extra year of pharmacy training would deepen my clinical knowledge and further my patient counseling skills and allow me to gain even more independent accountability for my own pharmacy decision making. So I really desire to go into psychiatric pharmacy, and I'm hopeful that this program would assist me in reaching my long-term career goals.
That's really awesome. That's great to hear. So I see you have this bioavailability project from your time in school on your CV. It's pretty interesting. What results did you find out about the project? How did that work out?
Oh, that, I did that P2 year, and I meant to actually take that off my CV, so you can just ignore that.
Yeah, so that project I was a P3 for, and we partnered with some P2s who didn't know what they were doing, and so they didn't do basically anything, so I did basically everything, just like with most group assignments. So I ended up getting a 100, everyone else did not, because I told the instructor I did all the work, I don't see why they should get the credit. But so it ended up being great because I did it.
Good.
Yeah, so we looked at the bioavailability of Tegretol versus carbamazepine and found that Tegretol was more bioavailable, and patients actually had an increased risk of seizures when they were switched to the generic carbamazepine. And during this presentation, I got to work with younger students in a team environment, and this actually sparked my interest in academia.
So tell me about a time when you made a recommendation to a provider and it wasn't accepted.
So a patient came in with sepsis, and so I recommended they be started on vancomycin because that's what I noticed that every patient is pretty much started on. But the doctor told me that he wasn't going to start Zosyn because the patient apparently had an anaphylactic penicillin allergy that I overlooked in the chart. But I don't even get why he said that, because there's not even penicillin in Zosyn, it's piperacillin.
This one time, this patient was taking just bolus insulin and not any basal insulin, and so I went to the doctor and I was like, what are you doing? Obviously this patient needs basal insulin also, and he kind of was like, well, I'm the doctor and I'm going to manage the patient, and I was like, kind of a moron, but whatever, it's fine. So he didn't listen, but like really, he should know better.
I once made a recommendation that antibiotics could be de-escalated, and one of my patients who seemed to be improving clinically after about 5 days, their white blood cell count was down, the patient was afebrile, and the bacterial cultures had become negative. The physician, however, did not want to step down the therapy at this time because of the patient's history of multiple antibiotic-resistant infections. So that day, I learned that it's very important to take the whole patient into consideration and that a team-based approach provides the best care.
Okay, so for a second, let's just pretend that you end up matching here at the residency, and now you're a clinical pharmacist rounding, and then a hospitalist comes up to you and says, we have a patient with the DVT, and they ask you if you can use warfarin for acute treatment. What do you tell them?
Yeah, warfarin thins your blood, so that would work on a DVT. So yeah, I would say warfarin's probably fine.
Like, is it Marshall? Marshall, is it that? What is this, like a joke? Of course that's not the right answer. It's ridiculous.
Well, since warfarin can take about 3 to 5 days to have a full anticoagulant effect, the patient should be bridged with a parenteral anticoagulant like Lovenox when warfarin is started until their INR is therapeutic.
So it's great getting to meet you and get to know you a little bit more this morning on our interview. But do you have any questions for us?
I think that pretty much covers it. I don't think I have any. Well, I actually do have one. I'm kind of hungry. Where's the cafeteria?
So So I guess like my biggest question and the thing that I'm most concerned about is what exactly are the staffing requirements? Because I have a very robust and engaged social life, and I want to make sure that I'm not here like every weekend. Like once a month is probably fine, but beyond that, is it more than that?
Yeah, so I saw the elective options listed on your program's website, and I'm just curious to know a little bit more about what the ID elective entails.
This is the girl that grew up in a Baptist school where we were not allowed to dance, so